Well, the Democrats are staying true to their motto, never let a crisis go to waste. And they are using the current crisis to try and, demonize our current healthcare system and claim, oh, if only we had gone to single payer system. And they're going out and taking advantage of everybody in panic mode to push out a lot of, nonsensical or even some crap out there without actually addressing what the underlying problems are. So we take a look at Bernie Sanders here. In the richest country in the world history, our medical workers do not even have the masks, gloves, ventilators, and protection they need right now. We need to fundamentally change the dysfunctionality, stupidity, and irrationality of the current system. And then Michael Moore goes off. Healthcare system run on greed based solely on making a profit. It is now guaranteed to kill millions of us. Still no masks, no gowns, no new ventilators or hospital beds. Nurses and doctors already stricken with the virus. What a way to bow out, America. We could have been better. Of course, they never actually want to take a look at what the underlying issues actually are, because the Democrats, they don't care if they create a problem and then the problem comes about and then they come off and try to demonize something and claim that this just means we need to do more of the activities that create the problem. All right, so first off, let's actually address, these ventilators, gowns, and all of that. So we've never had, a virus like this that from the very first, patient zero to global spread has never happened this fast, right? And so when we take a look at masks, gowns, ventilators, all of that, we based our supply of that based off of data over the last, 20, 30, 40, 50 years of data going, this is how much we generally need in a year. This is what we can handle manufacturing capacity. Therefore, that's what we have gone on. Now, we don't know what new virus is going to come out and hit everybody. We don't know about, what the effects of the next of a global pandemic, will be. So let's say, we had gone off and we stocked up on all these masks and ventilators, and we just stockpiled them, well beyond any, need shown by data, right? And the new virus hits. But the new virus, the symptoms of them don't require anything to do with ventilators, masks, and gloves. It has completely different symptoms. And we stockpiled up over here. Now we don't have the resources to start actually working on alleviating and handling the symptoms of this new virus. You see, it's very hard to try and plan for the unknown, plan for something that has never happened to us before. Right? And yet they're trying to act like this was somehow, a capitalist, private insurance problem where they purposely kept supplies low, didn't create adequate supplies. No, they had created adequate supplies. How are we supposed to know that in a very few short months, we would need quadruple more of what we've ever needed before? All right. Now, a second thing here. And this is what they don't address. So they're going off and saying, well, we still don't have them. We still don't have them. Well, have you ever thought about, the issues here that conservatives have been talking about, the loss of manufacturing in the United States, how it's very rare anymore to see anything labeled made in America, how, we make everything in Mexico, make everything in China. Yeah. Make everything all over the world. We've exported all of our manufacturing capabilities. And what we are seeing here is the problem with globalism. The left's favorite, ideology, the globalism, the global elite, and yes, we can make a case where you want to go through and, outsource what you can outsource and specialization and all of that. Yeah, there's a case, but there are certain things that even if you can make cheaper overseas, you don't want to do it, because you need it as a national security issue to stay in the United States. And so we've done, for decades, we've been letting our manufacturing capabilities, slide, lax, go away and outsource it all to other countries. Well, now we're dealing with a global pandemic, right? So all the manufacturing companies are located overseas. Well, they're dealing with the same issues that we are. And what are they doing? Well, they could be nationalizing the manufacturing plants. They can go ahead and declare that the orders from their own governments take precedent over orders, being received by, governments outside their own country. And so this is slowing down our manufacturing capabilities to be able to produce, these ventilators, these beds, these gowns, these masks. Why? Because we haven't been keeping up our infrastructure for manufacturing. It was Obama that says these jobs aren't coming back. These are the jobs of the past. They're going overseas. They're not coming back. We need to focus exclusively on high-tech jobs. Well, I understand, wanting to focus a lot more on the high-tech jobs and the changing of the career, but, we need to also keep, things like manufacturing of critical equipment and necessities within the United States. And this is something that Trump has been talking about since he had come into office, about bringing back manufacturing to the United States. He saw it as not only, good for our economy, workers, and reducing unemployment, but also as a national security issue. And now we are seeing that in play, where in a case of a global pandemic, it is very stupid to have most of our manufacturing capabilities located overseas in countries that are also facing the same pandemics and having the same needs from manufacturing. Only they have all the manufacturing facilities. But the Democrats, of course, they're not going to want to, talk about that. They're not going to want to talk about the outsourcing of our manufacturing. They're not going to want to talk about how do you plan for an event that's never happened, to us before, at a level that's never happened to us before. Now, before we go off and, continue on on a discussion about, the globalization and, specialization of capabilities that have run business that has led to this globalization that we are now seeing is leaving us vulnerable to reduced manufacturing capabilities in time of a crisis. How are those single-payer healthcare systems working out anyways? Bernie, you ever want to actually address this and talk about this? I know, Italy is overrun and people can talk about Italy's, old age, having a population that is the most at risk, or having such a high population that is found to be most at risk. But okay, let's exclude Italy there for a moment. How are the other single healthcare systems working? Well, let's take a look. Breitbart is reporting overwhelmed London hospitals turning away coronavirus patients. A report has claimed that Lewisham and Greenwich has become the first London National Health Services Trust to turn away coronavirus patients, sending them to other hospitals as they struggle to keep up with incoming cases. So single-payer healthcare would not have, helped out or improved the situation. They are struggling. Their hospitals and all of that are overwhelmed, and they have less population than us, right? These individual countries that make up the European Union and the UK, their populations are far smaller than us, and their single-payer healthcare system is still overwhelmed to the point where they are turning away patients. Luckily, here in the United States, because of decisions that we have made and actions that we are currently making, we are, in slowing the spread of this issue. Right? I'm saying of the issue to avoid the YouTube's, algorithm from banning this video or whatever. But because of the decisions that we've made to slow down the spread and, to prevent the hospitals from getting overwhelmed, we are actually, in comparison to other countries, in comparison to the single payer countries, we are doing better. Our medical facilities are doing better. Our, results that we are getting, for recoveries is doing better. Now, there are some cases where you could go off and say, well, the percentage of this country seems to be better than ours. They almost had no cases. I mean, if you're talking about, a total of 26 cases, in a particular country, That doesn't tell you anything. That doesn't say they've had a better result. They were almost left completely untouched. They had entire medical, government, medical facility focusing on less than 30 people. All right. I mean, you can get quite a good medical service, when you have an entire country focused on less than 30 people. All right. But any country that has had any significant amount of cases, we are seeing single payer healthcare systems being overwhelmed, even though they have less population than what we are seeing here in the United States. And so as the left goes on and they try to, manipulate and take advantage of people's fears and, spread information that is, half true at best, they're trying to take advantage of this crisis, and because they believe that getting people to go with their policy decisions, as bad as they are, is more important than focusing on actual problems and saving actual lives. So you want to know what's going on with the hospital? One, we are hit with something we've never come across before, right? That has quadrupled the demand of medical equipment, far beyond what we have seen in any historical, manner, right? Which you can't plan for that, right? Because you don't know which medical equipment is going to be needed. I mean, if this ended up being a virus that had diarrhea, we'd be talking about the shortages of IV fluids to keep you hydrated. And how did we not plan for that? Right? That's what they would be going off talking about. But the single underlying issue here, as we are struggling to keep up with the production of ventilators, masks, and all of that, has been a problem that has resulted from the outsourcing of our manufacturing. Now, we are starting to, reconfigure the manufacturing facilities that we have to ramp up the in-country production of these. But retooling manufacturing warehouses in order to accomplish that is not something that you can do just overnight. You gotta, ventilators and masks, they take different equipment in order to manufacture. And if you have to retool what manufacturing facilities that we have from what they were producing to these medical equipments, it takes time to retool those, right? First off, we got to make the machines in which to stock the manufacturing companies, with that. Then we got to get the supply chain, which is why we're running truckers, endlessly throughout this. And thank you if you are a trucker, in order to get the materials that we need to the manufacturing companies and manufacturing facilities to retool for what we need them to make, get the raw materials for what it is they need to make, get production and going, and then get them as they're produced back out to the hospitals. The issue here with the ventilators is not, a failure of our healthcare. It has been a failure to realize that we need to keep certain manufacturing capabilities in the United States rather than shipping them overseas.